Eileen Veilleux The Fam here. Welcome to a new installment in our mini mental health series. And in this installment, we are going to be covering delusional disorder. Before we start, let me remind you that there will be 3 keywords in the video, so make sure you watch the video in full. When I get to the keyword, I will say keyword and then what the keyword is. At the end of the video, in the comment section, along with your genuine comment, put in the 3 keywords to be eligible for a free merch giveaway when I reach 2,000 subscribers. So, let's get started. Delusional disorder, previously called paranoid disorder, is a type of serious mental illness called, keyword, a psychotic disorder. People who have it can't tell what's real from what is imagined. Delusions are the main symptoms of delusional disorder. They're unshakable beliefs in something that isn't true or based on reality. But that doesn't mean that they're completely unrealistic. Delusional disorders involve delusions that are bizarre, having to do with situations that could happen in real life, like being followed, poisoned, deceived, conspired against, or loved from a distance. These delusions usually involve mistaken perceptions or experiences, but in reality, the situations are either not true at all or highly exaggerated. A bizarre delusion, by contrast, is something that could never happen in real life, such as being cloned by aliens or having your thoughts broadcast on TV. A person who has such thoughts might be considered delusional, with bizarre type delusions. People with delusional disorder, though, often can continue to socialize and function normally, apart from the subject of their delusion, and generally do not believe in an obviously odd or bizarre manner. This is unlike people with other psychotic disorders who also might have delusions as a symptom of their disorder. But in some cases, people with delusional disorder might become so preoccupied with their delusions that their lives are disrupted. Although delusions may be a symptom of a more common disorders such as schizophrenia, delusional disorder itself is rather, keyword, rare. Delusional disorder most often happens in middle to late life and is slightly more common in women than in men. Now, there's different types of delusions and delusional disorders. The types are based on the main theme of the delusion. You have erotomanic, which is the person believes someone is in love with them and might try to contact that person. Often it's someone important or famous. This can lead to a stalking behavior. And then you have grandiose delusion, which is this person has an overinflated sense of worth, power, knowledge, or identity. They could believe they have a great talent or made an important discovery. Jealous? A person with this type believes their spouse or sexual partner is unfaithful. Persecutory, which is someone who has this belief or someone close to them are being mistreated or that someone is spying on them or planning to harm them. They might make repeated complaints to legal authorities. Somatic, they believe they have a physical defect or medical problem. Or mixed, these people have 2 or more of the types of delusions listed above. Wow, that covers a lot. Now, what are the symptoms of delusional disorder? Well, the symptoms usually include non-bizarre delusions, which are the most obvious symptoms: irritable, angry, or low mood. Keyword, hallucinations, which is seeing, hearing, or feeling things that aren't really there, related to the delusion. For an example, someone who believes they have an odor problem might smell a bad odor. What are the causes and risk factors for this disorder? Well, as with many other psychotic disorders, the exact cause of delusional disorder is not yet known. But researchers are looking at the role of genetic, biological, environmental, and psychological factors that make it more likely. The fact that delusional disorder is more common in people who have family members with delusional disorder or schizophrenia suggests genes may be involved. It is believed that, as with other mental disorders, a tendency to have delusional disorder might be passed on from parents to their children. Biological. Researchers are studying how delusional disorders might happen when parts of the brain aren't normal. Abnormal brain regions that control perception and thinking may be linked to the delusional symptoms. And as far as the environmental and psychological, evidence suggests that stress can trigger delusional disorder. Alcohol and drug abuse might also contribute to it. People who tend to be isolated, such as immigrants or those with poor sight and hearing, appear to be more likely to have delusional disorder. As far as that last part, I don't know how true it is. I was born with very poor eyesight, as but I am not isolated either. So I don't know, but I myself have never ever experienced any type of delusional disorder. So none of the factors that were mentioned in the bottom part of what I just read to you have been proven yet. That's why they say it's unknown. There's so many things that can cause a mental illness that it's just so hard to pinpoint the exact one. Now, some things can be pinpointed with certain things and others can't. But that is one that they still don't know what causes it. Wednesday, we will be going over the treatment and diagnosis for delusional disorder, and I hope that by watching this video, you have learned a little bit more and it has helped you to be able to see with your heart more and not your eyes. Because remember, people, we don't know what anybody's going through. We can't walk a mile in their shoes because we're not them. We don't know what their daily life consists of. We don't know what's going on in their brain, in their emotional stability. We don't know any of that. All we see is this. And if somebody starts yelling or acting abnormally or something, we're quick to snap and judge. But if you truly look at somebody with your heart and not your eyes, you think before you snap. And you can ask yourself questions, okay, before I snap, why are they like this? Could they be going through this? Could they be going through that? And yes, there are some people that are untreated for that, for any mental disorder. Excuse me. And when that happens, it does put us into a predicament because we can see with our heart, but to be continuously going through the abuse that that person puts on you because it's not treated, it's, that part's not right, and I agree. But always remember to see with your heart and not your eyes. Because when you see with your heart, you truly understand where a person's coming from the inside. Because what's important, the eyes can't see. It's only visible to the heart. So remember to see with your heart and not your eyes. And remember, there's one very important thing. You were uniquely made, and you out there matter to me. Yes, I'm talking to you. You're very important. You may not think it, you may not feel it, but you are. You were made for a reason. Don't let anybody tell you otherwise. You are uniquely made, you are yourself. And I accept you for you. The good, the bad, the ugly. I accept you just the way you are. So until I see you again, I love you all. Have a great day. Bye.